Up next, we have the most awaited item on our agenda, the SimCon quiz. This year's quiz will be done by Professor Manoji Patirage, Professor in Medicine at the Department of Medicine, Faculty of Medicine, University of Peradeniya, and Consultant Physician at the Teaching Hospital, Peradeniya. Over to you, Professor Manoji Patirage.
Thank you very much. Welcome to the SimCon Quiz and Answers 2021. So first of all, I would like to tell about the quiz. So this time, as the previous time, we are going to have it with the attractive prizes and certificates for the winners. I would like to display you the quiz guidelines. So you should click on the quick quiz link in the Zoom chat box. People who are present at the venue should scan the QR code. This quiz will have a total of 15 questions. All questions will have 5 answers. All questions will be given 30 seconds to answer. Points will be calculated by the fastest correct answer to response when allocating the marks. At the end of each question, answers will be discussed. And at the end of 15 questions, 3 winners, first, second, third, with the highest score selected to give certificates and prizes. So let me see how many participants there are at the moment. Marlon, I hope that you will be able to show us how many participants will be there. So I would like to tell all participants, you better display your name rather than displaying your mobile type like iPhone 6, iPhone 51, Samsung 66. So because it will be difficult us to see who are the leading people at the end of 5th question and at the end of 10th question. So therefore, please put your original name. So then it's easy for us. So at the moment, we have 53 players. Okay, still we are getting some more. Because we are a little late at the moment. Now we have already late for 15 minutes. So right, I hope now there won't be any additions. Okay, so then shall we start? Marlon, I'm going to start it now. So please click the quiz link in the Zoom chat box, or people who are present here, please scan the QR code, enter your name to start the quiz, right? So 3, 2, 1, here we go. This patient is from Vaunia, presents with non-healing ulcer. So what is the diagnosis? Cutaneous leishmaniasis, lupus vulgaris, necrobiosis leprotica diabeticorum, hydoma gangrenosum, tuberculin skin.
Doctor,
Yes.
you need to screen share your PowerPoint.
I hope I'm sharing. Not yet. Okay, just
No.
give me 1 second. Okay, so let's start. This patient is from Vaunia, presents with non-healing ulcer. So these are the answers. What is the diagnosis? Cutaneous leishmaniasis, lupus vulgaris, necrobasis lipodica diabeticora, hyderma gangrenosum, tuberculin skin test. So Marlon, hope you will be timing. Right? Right, time is up. So the answer is tuberculin skin test. So a 35-year-old male presents to you, your practice with a blood pressure of 180 by 110 millimeters mercury on routine checkup. Next, please. What is the unifying diagnosis? Right. So we'll go for the answer. So it's neurofibromatosis. You can see the neurofibroma and the caveolate spots there. Right. We'll move to the third question. So it is about a 45-year-old diabetic male presents with progressive shortness of breath for 2 weeks duration. On examination, he is dyspneic with a respiratory rate of 28 per minute and blood pressure of 90 by 50 millimeters mercury. Next. So this shows this patient's ECG. Have a look at. Can you please go back to the ECG, Marlon? Yes, this is the ECG. Right, we'll move to the answers. What is the diagnosis? Okay, so time is up. So the answer is cardiac tamponade. So you can see the fast AF or electrical utterance and tachycardia. Right. The next question is, what physical sign you will not expect in this patient? Wait. Right, so the answer is loud second heart sound. The fifth question, what is the next step in the management of the above patient? Okay, the answer is pericardiocentesis. Right. So, Marlon, is it possible us to see who are the leading people at the moment? Now we are at the end of fifth question. Okay, so Bandara is the leading one, then the Sashini Vincent, Tushara Matthias, Savandika, Sankar, and Pradeep. Okay, we'll move on to the sixth question. A 48-year-old teacher presents with tremors and involuntary movements in both hands, which is progressive over last 2 years. On examination, he has cervical dystonia with increased tone in both upper limbs. The picture shows MRI brain of this patient. Okay. What is the radiological diagnosis? The answer is Hallerwarden's disease because the MRI shows the tiger eye sign. Let's move to the other one. Okay, this shows the tiger eye with the MRI, so you can compare it. Okay, we'll move to the other question. Next one, right. What is the salient radiological abnormality in this chest X-ray? Okay, so it shows the rib notching. Move to the other question. The bearer of the previous chest x-ray is a 35-year-old male who presents to the medical clinic with intermittent claudication. His blood pressure is 170 by 100 millimeters mercury. What is the unifying diagnosis? So the answer is coarctation of the aorta. Next question. This is a microscopy of knee joint aspirate. What is the diagnosis? So it is monosodium urate crystals or the gout. Next question. The above aspirate belongs to a 48-year-old male presents with severe pain over the right knee joint. On examination, right knee joint is warm, tender, and swollen. His ESI is 65 and white cell count is 14,000 and the serum creatinine is 350 millimoles per liter. RBS is 280 and cultures are negative. What is your next step in the management of this patient? It is to start Yes, here the best answer is to start colchicine as this patient has got high blood sugars as well as altered serum creatinine levels. So at the end of 10th question, shall we see now who are the leading people? So now Savandika is the leading one, and then the DK Jayavira, Vitharana, Ranga, Shankar, and Milini Vikulan. Okay, so let's move on to the 11th question. A 25-year-old female presents with hallucination since 4 p.m. after having a family dispute. A younger brother found following parts of a plant on her table. Identify the plant. Right. So it is Datura or Attana flower. Yes. So we'll move to the other one. What is the likely chemical responsible for her symptoms? So the answer is atropine. Let's move to the other one. Okay, this is a 70-year-old male presents with persistent headache. Following picture demonstrate his fundoscopic appearance. What is the diagnosis? Can I see the yes? So the answer is anterior ischemic optic neuropathy. Next question. So it was seen in giant cell arteritis. So this is a macroscopic appearance of an adrenal gland of a patient. What is the diagnosis, underlying diagnosis? Okay, so it's Sons adenoma. Okay, so now we have come to the last question of the SimCon 2021 quiz. This patient is on anti-TB treatment for 2 months and presents with excoriating rash over both arms as shown here. What is the diagnosis? So the answer is pellagra. So now we have come to the end of the SimCon 2021 quiz. Shall we see the winners? Okay, so Savantika has got 126 points. Congratulations, Savantika. Second one is PK Jaivira, who has got 115 marks, and the third is Ranga. So we have three third positions, Ranga, Shankar, and Maheshi. So I think we may need a help from the rest of the people, or else we can declare that all three have got the same marks. So therefore, congratulations all five of you who have become the winners of the SimCon 2021 quiz. So I would like to announce that all the winners, please send us your contact details, including your name and mobile number. So we will send your token of appreciation and the certificate. And is it possible as to know anybody who is there physically at the venue? So I would like to hand over to Dr. Krishanta Jayasekara, who will be there physically. Krishanta, over to you, and you will be able to see if there are anybody who is physically present there. And I hope that Marlon will be able to tell us whether anybody of them are physically there or all are virtual participants.
What is your good name, please?
It concludes the end of the SimCon Quiz 2021. Thank you all for your participation.